Have you been struggling with arthritis, suffering from pain, swelling, and inflammation in your joints? If so, you are not alone. In this video, I will discuss a natural, research backup remedy that could help you. I am talking about turmeric, and I will explain you 3 reasons why I believe you should try it if you're dealing with arthritis.
rheumatologistoncall.com.
A few years ago, my father was complaining about severe pain, swelling, and was almost unable to walk because of pain in one of his knees. My father has a heart disease and diabetes, and NSAIDs or anti-inflammatory medications like diclofenac or ibuprofen are not ideal in his case, as they can cause more side effects than benefit. However, I gave my father a course of naproxen for about 2 weeks, but it did not help. Then, as a rheumatologist, I proposed him to do a steroid injection in that knee. I did that and again waited for approximately 2 weeks. Unfortunately, was no improvement. So what to do? I could not give him another course of NSAIDs or anti-inflammatory medication. I could not do another injection. But then I remembered that a patient of mine told me about this supplement that he was using for a few months, and it was very helpful for his knees. And this supplement was called turmeric. As you probably know, I have a PhD in immunology, and I will have to search and see if there is any scientific evidence. Is this truly a good supplement? After all, I was giving this to my own father. Here I go. I embark myself in a research for scientific evidence, and here is what I found. Number 1, turmeric has potent anti-inflammatory effects. The key to turmeric potential for relieving pain is related to its active ingredient called curcumin. There are numerous studies that will demonstrate curcumin's anti-inflammatory effect. By decreasing inflammation, turmeric will reduce the pain. You see, there are different forms of arthritis, and people suffering from rheumatoid arthritis, psoriatic arthritis, or ankylosing spondylitis, they do suffer from a lot of inflammation that can cause severe damage to the joints. People with osteoarthritis or the wear and tear arthritis can also suffer from a low degree of inflammation. Now, in my research, I found out that there were more than 10,000 studies about turmeric and about turmeric and inflammation. And there were more than 120 clinical studies, meaning that they were studies in humans. Now, curcumin can help fight this inflammation through several mechanisms. It can block the inflammatory enzymes like COX-2 enzyme, and this is the same enzyme that is blocked by NSAIDs like ibuprofen or naproxen, and in this way will decrease inflammation. Curcumin can also reduce the production of certain inflammatory proteins that we call cytokines, and in this way will decrease the level of TNF-alpha or others in the body, which again will reduce inflammation. There are also some animal studies that found out that curcumin will lower the oxidative stress, which can protect the joint's cartilages and will reduce the wear and tear process. By disrupting inflammation and protecting the cartilages, curcumin might potentially decrease the pain, decrease the swelling, and slow down the progression of the disease. Number 2. There is clinical evidence for arthritis relief. So, is turmeric going to work for people with osteoarthritis, rheumatoid arthritis, or psoriatic arthritis? In 2016, a study that included many randomized controlled trials found out that 1,000 milligrams per day of curcumin reduces osteoarthritis pain and inflammation, as well as anti-inflammatory medication like diclofenac or ibuprofen. And this is very important because, as I said, if you have contraindications like heart disease, kidney disease, or a previous GI bleed, NSAIDs are not an option for you. And this was the case of my father. Remember, he had heart disease, and using ibuprofen or naproxen can cause him a heart attack. In a more recent study in 2020, there was randomized controlled trials of 70 patients with knee osteoarthritis, and they compared curcumin with placebo or an inactive pill. And here are the results. Patients that received curcumin 1,000 milligrams per day for 3 months had less pain when compared to placebo. When it comes to rheumatoid arthritis, the results are quite impressive. In a study from 2016 on patients with rheumatoid arthritis, they found out that curcumin 1,000 milligrams per day for at least 90 days resulted in decreased inflammation, decreased pain, and decreased number of tender and swollen joints. Now, even in patients with psoriatic arthritis, a study that was published in 2020 showed that curcumin will inhibit the pro-inflammatory molecules in the immune system cells, and that will lead to improvement in both the skin and the joints. But you have to know, the dose matters. These studies showed that a dose of 1 to 1.5 grams of curcumin is the one that is effective. Plus, you should also choose a product that is enhanced with pepper because that will enhance the absorption of curcumin. Number 3, there is a long history of medicinal use. My third reason for trying curcumin is its long-standing use in traditional medicine around the world. You see, in India and other parts of Asia, turmeric was used to treat inflammatory conditions, infections, wounds, digestive issues, and even more. Importantly, turmeric is also considered relatively safe when it's used appropriately. Most studies report only mild, infrequent side effects like stomach upset, and no major safety concerns have emerged from the clinical trials that I've seen. But there is a warning. Be careful that high doses of turmeric or curcumin can act as a blood thinner or can worsen the effect of blood thinners like Coumadin or warfarin. As always, I do recommend you to speak to your doctor before taking a supplement. But this long story or long history of turmeric is reassuring. Now, what happened with my father's knee pain? He started to use this supplement, and I will link the product in the description of this video, and in about 2 weeks, his pain decreased, the swelling decreased, and he was able to walk so much better. In about a month, he just had a little bit of pain with prolonged walking. And in 3 months, he had no more pain and no more swelling. Now, not all of you might be using turmeric to cook with it. And even if you cook with turmeric, you might not be using the correct dose. So you might consider using a supplement. If you are looking for a good quality supplement, you might want to check the link that I put in the description of this video, because this is a product that is considered of good quality. The best way to ensure the quality of a product is to look for one that has been certified by a third-party company. Being evaluated by a third-party company, the supplements will receive a certificate of analysis. And this certificate will attest that what is said to be in that supplement is actually in there. The same components and the same doses remain the same after different batches. And there are different certificates like NSF or USP or Consumer Lab, and I would strongly recommend you look for these certifications. My advice is that with any supplement, start with a low dose, and you can gradually increase the dose while you monitor for side effects. And always reevaluate the effect on this supplement on your body every 2 to 3 months. If you see a benefit, you should continue. If you don't see a benefit, stop it. Now that you understand how turmeric can be properly used to reduce inflammation and pain, You might be surprised what other supplements can do for your arthritis. So I invite you to watch this video in my channel.
rheumatologistoncall.com